Have you ever looked down at your hands and wondered why those long, vertical lines seem to become more visible every year? Perhaps someone told you not to worry. Perhaps you've heard that everyone gets them eventually. Maybe your doctor glanced at your nails during a routine checkup and simply said, "That's part of aging." And at first, that explanation sounds reasonable. After all, your sister has them. Your neighbor has them. Many people over 60 seem to have them. So it must be normal, right? But what if that explanation only tells part of the story? What if some nail ridges are completely harmless, while others are quietly reflecting changes that have been developing inside your body for months? Because here's something most people never consider. Your nails are not just cosmetic. They are not simply something you trim every few weeks and forget about. In many ways, your nails can serve as a record of what has been happening inside your body over time. And sometimes they begin showing clues long before people connect them to nutrition, health, or aging. Now, I want to be very clear. Not every ridge is dangerous. Not every change means something serious is wrong. But there is a difference between normal age-related changes and the kinds of nail changes that deserve a closer look. The problem is that most people never learn how to tell the difference. Instead, they assume all ridges mean the same thing. They buy a strengthening cream. They apply nail oils. They try various cosmetic products. Weeks pass, months pass, and the ridges remain exactly where they were. Today, we're going to explore why that happens. We're going to uncover 3 common myths that prevent people from understanding what their nails may actually be telling them. And by the end of this video, you'll understand why the most popular solution is often the one least likely to address the root cause. My name is Dr. James Carter. For years, I've focused on helping older adults better understand the relationship between nutrition, healthy aging, and the subtle signals the body sends long before major symptoms appear. The goal of this video is not to create fear. The goal is awareness. Because small changes often happen quietly. A little more fatigue, a little more hair shedding, a little less energy, a few ridges appearing on the nails. Each change may seem insignificant on its own, but sometimes those small clues begin to form a larger picture, and that's exactly what we're going to discuss today. As always, this video is intended for educational purposes only and should never replace medical advice from your healthcare provider. If you have concerns about your health, please speak with your doctor. Now, before we talk about the 3 biggest myths surrounding vertical nail ridges, you first need to understand one important fact. The nail you're looking at today was not created yesterday. And once you understand that, everything else will begin to make much more sense. Most people assume that their nails reflect their current health, but nails don't work that way. The nail you see on your finger right now may have started forming 3, 4, or even 6 months ago. In other words, what you're looking at today is actually old information. Everything begins in a small structure hidden beneath the skin at the base of the nail. This structure is called the nail matrix. You can't see it. You can't touch it. Yet it is responsible for producing every millimeter of nail that eventually becomes visible. Inside the matrix, specialized cells continuously divide and multiply. As they mature, they become packed with a tough protein called keratin. Those cells are then pushed forward little by little until they emerge from beneath the cuticle and become the nail plate you see every day. The process never stops. Even while you're sleeping tonight, your nail matrix will continue working. Think of it like a slow-moving printer. Every day, the printer produces another small section of the final document. If the printer receives everything it needs, the output is smooth, clear, and consistent. But if there is a problem with the supplies, the quality of the final document begins to change. Your nail matrix works in a very similar way. The matrix depends entirely on the materials it receives through the bloodstream: protein, iron, vitamins, minerals, oxygen. Everything needed to build healthy nail tissue must first travel through your body before it reaches the nail factory. And that's why this matters. If your body was lacking important nutrients 3 months ago, your nails may only be showing signs of that shortage today. If your nutrition improved recently, the positive changes may not become visible for weeks. Nails move slowly, much more slowly than most people realize. This is one reason healthcare professionals sometimes pay attention to nail changes, not because nails diagnose disease. They don't, but because they can occasionally provide useful clues about what has been happening inside the body. The nail you're looking at today is essentially a delayed reflection of your body's past conditions. And once you understand that, a very important question naturally follows. If nail ridges can reflect more than simple aging, How do you tell the difference between a harmless age-related change and something that deserves attention? That's where the first myth begins. Let's begin with the first myth. It's just age. There is some truth in that statement. As we grow older, many processes inside the body begin to slow down. The nail matrix is no exception. After the age of 60, cell turnover gradually decreases. Cells divide more slowly than they once did. As a result, many people develop fine vertical ridges that run from the base of the nail to the tip. Dermatologists often consider mild ridges to be a normal part of aging, and in many cases, they are absolutely right. But this is where the conversation usually ends, and that's a problem, because not all ridges are created equal. A single fine ridge that has remained stable for years is very different from multiple deep ridges appearing across several nails. It's different from nails that split easily. It's different from nails that become increasingly brittle over time, and it's certainly different from nail changes that appear alongside other symptoms. For example, imagine two women who are both 70 years old. The first woman has a few mild ridges. Her nails remain strong. Her energy is good. Her hair looks healthy. Her skin heals normally. The second woman is the same age, but her nails have become increasingly fragile. The ridges appear deeper. Her hair seems thinner. She feels tired more often. Small cuts take longer to heal. Both women are aging, but their situations are not identical. Age may explain part of the story. It does not necessarily explain all of it. That's why I often tell patients something very simple. Age affects speed. Nutrition affects quality. The nail factory may slow down with age, but the quality of the materials entering that factory still matters. A lot. When deeper ridges appear together with other changes, it may be worth asking additional questions. How much protein are you eating? Are you getting enough iron? Could your vitamin B12 levels be lower than they used to be? Are you absorbing nutrients as efficiently as you once did? These are questions many people never consider because they stop at the word aging. And that's unfortunate, because sometimes the nail is simply drawing attention to something that deserves a closer look. Not fear, not panic, just awareness. And that brings us directly to the second myth. The myth that sends millions of people searching for the wrong solution. The second myth sounds logical. In fact, it's probably the most common explanation people hear. You need more calcium. If your nails are weak, brittle, or ridged, someone will eventually suggest calcium. After all, calcium is associated with strength, strong bones, strong teeth, strong structure. So it sounds reasonable, but here's the problem. Your nails are not miniature bones. They're something entirely different. The visible nail plate is made primarily of keratin. Keratin is a structural protein, the same protein that helps form your hair and contributes to the protective outer layer of your skin. And while calcium plays important roles throughout the body, it is not the main ingredient that determines nail structure. Think of it this way. Imagine a bakery struggling to produce quality bread. The loaves aren't turning out properly. The texture is inconsistent. The quality keeps declining. Now imagine someone responds by delivering bags of cement. Cement is useful. It has value. But it isn't what the bakery needs. The bakery needs flour, yeast, water, the materials required to make bread. The same mistake happens when people assume every nail problem is a calcium problem. The body may actually be missing completely different materials. Materials directly involved in building healthy nail tissue. And that leads us to 4 nutrients that repeatedly appear when researchers study nail health. Protein, iron, vitamin B12, and zinc. Each one plays a different role. Each one supports the nail matrix in a different way. And together, they help determine the quality of the nail that eventually grows out months later. Let's take a closer look at each of them, because understanding these 4 nutrients may completely change how you think about nail health. Now we arrive at the part of the story that most people never hear. If calcium isn't the main answer, then what exactly does the nail matrix need in order to produce strong, healthy nails? To answer that question, let's go back to the factory we've been talking about throughout this video. Every single day, hidden beneath the cuticle, your nail matrix is hard at work. It never takes a vacation. It never stops for weekends. It never asks for a break. Day after day, month after month, year after year, it continues producing new nail tissue. But like every factory in the world, it depends on supplies. When the right materials arrive consistently, production runs smoothly. The final product is stronger, more uniform, and more resilient. When important supplies become limited, production continues, but quality may suffer. And among all the nutrients involved in nail growth, four deserve special attention: protein, iron, vitamin B12, and zinc. Let's begin with protein. Most people associate protein with muscles. They think about athletes, weight training, fitness magazines. What they don't realize is that nails depend heavily on protein too. Remember, nails are primarily made of keratin. Keratin is a protein structure, and proteins are built from amino acids. Without enough amino acids, the nail factory simply has fewer building blocks available. Imagine trying to build a house while receiving only half the lumber you ordered. The workers may still show up. The plans may still be available. But sooner or later the shortage becomes visible. The same thing can happen inside the nail matrix. The factory continues working, but it doesn't have everything it needs to produce the highest quality product. This is particularly important for older adults. Many people over 60 unintentionally eat less protein than they think. Breakfast may be coffee and toast. Lunch may be soup. Dinner may be something light. Day after day, protein intake slowly decreases, and because it happens gradually, many people never notice. Yet, the body notices, the muscles notice, the immune system notices, and sometimes the nails notice too. Now let's talk about iron. Iron performs one of the most important jobs in the human body. It helps transport oxygen through the bloodstream. Every tissue depends on oxygen, including the cells inside the nail matrix. Think of iron as the delivery system that keeps the factory operating efficiently. Without regular deliveries, production becomes less efficient. The machines still run, but not at their best. The nail matrix contains rapidly dividing cells. Those cells require oxygen and nutrients to perform their work. When iron stores become too low, those cells may not function as efficiently as they should. And here's something many people don't know. You don't have to develop full anemia before low iron begins affecting the body. Iron reserves can decline long before anemia appears on standard blood tests. This is why healthcare providers often measure ferritin, which reflects stored iron levels. A person may feel tired more often. They may notice increased hair shedding. They may experience reduced stamina, and sometimes subtle nail changes begin appearing as well. Next comes vitamin B12. This nutrient doesn't always receive the attention it deserves, yet it plays a critical role in helping the body create healthy new cells. Every visible nail began as a living cell inside the nail matrix. Those cells must divide again and again before eventually becoming the nail plate you see on your finger. Vitamin B12 helps support that process. What's particularly interesting is that B12 deficiency becomes more common with age, not necessarily because people stop eating foods that contain it, but because the body's ability to absorb it often changes over time. As we grow older, stomach acid production may decrease. Certain medications may also influence absorption. The result is that some individuals consume enough B12, yet absorb less than they realize. Over time, the effects can become noticeable: fatigue, weakness, reduced energy, and sometimes changes involving the hair, skin, and nails. Finally, let's talk about zinc. If protein provides the raw materials and iron helps deliver oxygen, zinc acts like quality control inside the factory. Hundreds of biological processes depend on zinc, including many involved in tissue growth and repair. Without adequate zinc, production doesn't necessarily stop. Instead, it may become less efficient, less organized, less consistent. Imagine a factory where all the workers show up but nobody is supervising the process. The materials are present, the equipment is functioning, yet mistakes begin appearing throughout production. That's a simple way to understand zinc. Researchers have repeatedly documented relationships between zinc deficiency and changes affecting the skin, hair, and nails. And because zinc participates in so many biological processes, even modest deficiencies may have visible consequences over time. Now here's the most important thing to understand. These four nutrients do not work independently. Protein, iron, vitamin B12, zinc. They're part of the same team. And in real life, deficiencies rarely occur one at a time. Someone who eats very little protein may also consume less iron. Someone whose appetite has decreased may also be getting less zinc and vitamin B12. The nail matrix doesn't experience these challenges separately, it experiences them together. And that helps explain why so many people spend years focusing on the wrong solution. Because once you understand how nails are actually built, something becomes very clear. The answer usually isn't found in a cosmetic product. The answer often begins much deeper than that. Which brings us to the third and most misleading myth of all. The myth that keeps countless people treating the surface while ignoring the source. Now let's talk about the third myth. And in many ways, this is the most misleading one of all, because unlike the first two myths, this one actually feels logical. You notice a problem on your nails, so you apply something directly to your nails. Simple, straightforward, reasonable. If your skin is dry, you apply moisturizer. If your lips are dry, you apply lip balm. So if your nails develop ridges, why not apply a cream? That's exactly what millions of people do. They purchase strengthening treatments, nail oils, repair serums, special creams. And to be fair, these products are not completely useless. Many of them can improve the appearance of the nail surface. They may reduce dryness. They may make the nail feel smoother. They may help protect the edges from splitting. But here's the problem. The nail you're applying the cream to is already finished. It's already been built. The factory completed that section months ago. Think about that for a moment. The visible nail on your finger is not under construction anymore. It's the final product. The actual construction site is hidden beneath the skin inside the nail matrix. And that matrix receives its materials through the bloodstream, not through the nail surface. Imagine an apple tree producing poor quality apples because the soil lacks nutrients. You could polish every apple on the tree. You could spray them with water. You could make them shine. But none of those actions would improve the soil. And until the soil improves, the next generation of apples will continue having the same problem. The nail matrix works in a similar way. If nutritional deficiencies are contributing to poor nail quality, the solution has to reach the matrix, and the matrix receives its supplies through what you eat, absorb, and circulate throughout your body. That's why nutrition becomes so important. Let's start with iron. One of the simplest ways to support healthy iron intake is through a combination of iron-rich foods and vitamin C. Many plant foods contain iron: lentils, beans, chickpeas. But plant-based iron is absorbed less efficiently than iron from animal sources. Fortunately, vitamin C can significantly improve absorption. A squeeze of lemon over lentils, a kiwi with breakfast, a serving of bell peppers alongside beans. Small changes like these can make a meaningful difference over time. Next comes vitamin B12. Eggs are one of the easiest foods to include regularly. Fish is another excellent source. Shellfish can provide substantial amounts of B12 as well. For individuals who consume little or no animal products, it's worth discussing B12 testing and supplementation with a healthcare provider. Now let's talk about zinc. One of the most practical sources is pumpkin seeds. A small handful can easily be added to a daily routine. Other sources include legumes, meat, poultry, and cheese. And finally, protein. This is often the most overlooked nutrient in older adults. Many people assume they're eating enough. But when meals become smaller over time, protein intake frequently declines. Eggs, Greek yogurt, fish, chicken, beans, lentils. These foods help provide the amino acids required for keratin production. And remember, consistency matters more than perfection. You don't need a complicated diet. You don't need expensive supplements. You don't need a miracle product. You simply need to provide the nail factory with the raw materials it requires on a consistent basis. If you're concerned about possible deficiencies, a conversation with your healthcare provider may be helpful. Blood tests such as ferritin, vitamin B12 levels, and a complete blood count can sometimes provide valuable information. And that leads to one final question. If you improve your nutrition today, when should you expect to see changes in your nails? The answer surprises many people because nail improvement doesn't happen overnight. This is where expectations become extremely important. One of the biggest reasons people give up is because they expect results too quickly. They improve their diet for 2 weeks, maybe 3. They look at their nails, and they see no difference, so they assume nothing is working. But that's not how nail growth works. Remember what we discussed earlier? The nail you're seeing today began forming months ago. That means today's ridges are history. They're a record of the past. You cannot erase them overnight. You cannot smooth them away in a weekend. And you cannot rebuild nail tissue that has already been completed. What you can influence is the new nail currently being formed inside the matrix. That's where change begins. For most people, early improvements may become visible after 6 to 8 weeks. And even then, the change often appears in a very specific way. The area closest to the cuticle begins looking slightly smoother, slightly more uniform, slightly healthier. Meanwhile, the older portion of the nail still contains the ridges that formed months earlier. Over time, that healthier section gradually moves forward as the nail continues growing, month after month, little by little. Eventually, the older section is trimmed away, and the newer section replaces it. That's why patience matters. Think of it like planting a garden. You don't plant seeds today and harvest vegetables tomorrow. Growth takes time. But if you never plant the seeds, there will be nothing to harvest later. Nail health follows the same principle. Consistent habits create gradual improvements. Now, before we finish, there are several situations where nail changes deserve prompt medical attention. Deep horizontal grooves running across the nail may indicate previous illness, significant stress, or other medical conditions. Dark streaks beneath the nail that appear unexpectedly or change over time should always be evaluated by a healthcare professional. Yellow, thickened nails may suggest a fungal infection that requires proper diagnosis. Blue or purple discoloration without injury may indicate circulation or oxygen-related concerns. Pain, swelling, bleeding, or sudden dramatic nail changes should never be ignored. This video focuses specifically on vertical ridges and nutritional factors, but any nail change that concerns you deserves professional evaluation. The goal is not self-diagnosis. The goal is awareness, because awareness helps people ask better questions, and better questions often lead to better decisions. So let's summarize what we've learned today. Not all nail ridges are the same. Some are a normal part of aging. Others may reflect nutritional factors worth paying attention to. Nails are primarily made from keratin, not calcium. Protein, iron, vitamin B12, and zinc all play important roles in healthy nail growth. Creams can improve appearance, but they cannot replace the nutrients required by the nail matrix. And meaningful improvement requires patience because nails grow slowly. Now I'd love to hear from you. Which myth surprised you the most? Myth number 1, it's just age. Myth number 2, you need more calcium. Or myth number 3, a cream will fix it. Leave your answer in the comments below. And if you found this video helpful, consider subscribing for more practical information about healthy aging, nutrition, and the small signs your body may be giving you every day. I'm Dr. James Carter. Your nails may not tell you everything about your health, but sometimes they tell you enough to start asking the right questions. And those questions can change far more than the appearance of your nails. Thank you for watching, and I'll see you in the next video.